like to welcome everybody to today's webinar titled Making Survivorship Care Plans Work for the Patient, a collaboration between CliniSync and Southern Ohio Medical Center's Cancer Center. If you do have any questions during today's webinar, feel free to enter your question at any time by expanding the toolbar for GoToWebinar and entering your question in the question box. If you can't find the question box, put it in the chat box and we will find it there as well. Also, if you'd like to download a copy of today's slides, you can go into the handouts feature of GoToWebinar. With that, I'm going to turn it over to today's speaker, Miss Kathy Costello. I have to shut that down so you.
Okay. Thanks so much, Scott, and thank you all for joining us. This has been a real process for us. We've worked very closely with the Ohio Department of Health under the Center for Disease Control, Cancer Control grant, and we'll look at that in just a minute. But today I am very pleased to introduce to you two of our presenters who have worked with us and given us significant feedback this year in this process of a several-year grant process. Wendy Waugh, who is the Administrative Director of the SOMC Cancer Services and Ambulatory Infusion Clinic, and Rochelle Collins, who is a Nurse Manager for SOMC's Cancer Services. And I'm going to turn it over to Wendy and let her tell you a little bit about Southern Ohio Medical Center and the good work that they are doing. Wendy, to you.
Absolutely. Thank you, Kathy. And good afternoon. I can say that because it's just after 12 o'clock. So good afternoon. Coming from you in lovely Appalachia, Southern Ohio. So our organization is right on the river, and we can actually see Kentucky Hills, Rochelle and I, from our office. And we're about 20 to 30 minutes from West Virginia. So right in a tri-state area. And we're a small rural hospital, nonprofit organization, and we're home to about 3,100 employees, 280 providers, and 400 volunteers. We are a magnet hospital. We've been named Best Places to Work in Healthcare by Modern Healthcare, and we're one of Fortune's 100 Best Companies to Work for. And a little bit about our cancer program. Scott, next slide. So our cancer program is actually American College of Surgeons COC accredited, and that is really important for today's conversation related to survivorship care plans. We're also accredited in by ACR in radiation oncology. We also are NAPBC accredited, and that is also important for today's conversation. We do in-core clinical trials. We have a combined building that we have our breast center services and women's services in the lower level of the building. We use Mosaic as our EHR for cancer services, and we have been an oncology care model site since 2016 for medical oncology when that program began.
Thank you, Wendy, so much. And I apologize if there's a little lag on the slide. So I think it's just transmission issues. Besides SOMC, in order to understand what we're going to be talking about, I just have to lay out a little bit about CliniSync and the health information exchange that we represent, because that kind of comes together with what SOMC is doing. We were originally founded as the Ohio Health Information Partnership, is our umbrella organization. CliniSync is the name that most of you would know us under in the marketplace. And we were founded by a large consortium of hospitals, physicians, input from the state. We continue to this day to have a multidisciplinary board of directors that really spans the whole spectrum And that also includes a technical advisory council that gives us input on all of our technical direction for the organization. The important part for this presentation is the size of the information that's available to us as the Health Information Exchange, because for those of you who may not be as technical or need the services of the HIE regularly, the HIE is basically the information highway for most of Ohio. And what that means is that no matter what electronic record system in hospital or physician group, a hospice, a long-term care, you know, you name it, social service agency, that information can come through us. We integrate with all those different types of providers, and that information for the patients then flows not into a master database, resides with the organization, but when you query for information, we are the folks that go out and find that in just a second or two around the state or nationally, wherever that information resides, brings it back to you in a consolidated record. And so it's important to know that you have access to the many patients that you may be seeing to understand the process that we are talking about today. We have 155 hospitals within the state that we are integrated with. We have thousands of providers who are part of our system, and we have 12 health plans that also contribute data. So the types of information that we have is very rich on the clinical side and does provide an answer to some of the questions that we found as a result of this particular program that we started working on a few years ago. In order to understand what we are going to be presenting technically, you just need to understand how we get information as the HIE. So when information flows to us, the reason we're able to pass it from one organization to another is it has to be in a common format, that when the second organization needs that information, we can send it and be assured that they receive it in the same format that it was sent. So when we receive information from organizations like SOMC, it will be in a standardized format called Continuity of Care Document, or CCD, and all that means is a kind of fancy name just for a summary of care. So when a patient is discharged, or if a patient's seen in the outpatient area, and a summary is created at the end of that visit, that's in the CCD format. It flows to us, and it has these various fields in it that you see around the wheel here, where it will have the patient's meds, the problems, the allergies, their labs, their demographics, any procedures they had done, for any care plan, for any place that is contributing data to us. And so we receive much data on a patient, as well as their labs, the radiology, and their transcription results. So it is really quite extensive for any patient who has received care within the state of Ohio. Now, to go back to the grant, now we're going to move into what I imagine most of you are interested in hearing, is how we ended up with SOMC looking at this process, and then how SOMC is moving ahead in a new look-see, shall we say, of survivorship care planning and what that means. So to start with that, Scott Match and I, who are partners at CliniSync, spend a lot of our time working in specialized programs out in the field. This particular one was with the Ohio Department of Health, as I mentioned, under the CDC grant, and went back to 2019. And I have to say, you couldn't, we all had to kind of smile to ourselves, including our project manager at ODH, Emily Bund, who has realized that the timing of this grant was, shall we say, at cross purposes to what was going on in the survivorship area in the cancer planning. So when we were requested to work on this, or we received the grant for it, it was part of a larger cancer control grant that went to the various states across the country who were working on cancer control. This was, there were 6 priorities, of which supporting cancer survivorship was only one of those areas. And we came in as kind of a step 2 when the CDC decided to expand that grant to include this cancer survivorship plan program, in which they wanted to see if we could take the cancer survivorship plans and basically put them in some type of format that it could move electronically. And the reason that was important to the CDC is that, as all of you know who work in the cancer survivorship area, it was and still is to this day extremely manually and labor intensive to create a survivorship care plan. And it can easily be out of date soon after it's created, and has a lot of questions about how it is used and what is the best format. So they were interested in seeing if, as part of the larger approach to cancer survivorship and interoperability, they could have someone across the country develop a plan on how this could be done technically. And so they, as I mentioned, released the request for funding for this in January of 2019. At that time, a point in time, I mean, this is a point important to know, point in time, at that time, the Survivorship Care Plan was still a required element for all the big accreditation programs for cancer centers, especially the Commission on Cancers, or COC's, accreditation process. And what we saw is that pretty much simultaneous to when ODH and CliniSync worked on getting this grant up, that same year, COC released updated standards that went into effect for 2020 accreditation, in which this requirement was removed as a requirement and instead became permissive on whether or not a cancer center used cancer survivorship forms. So year 1, this is Scott and myself back there between, Scott's laughing too on the side over here, remembering what we went through. This was like later in 2019 and going into early 2020. And we were newbies to the process. Neither of us had worked on survivorship care planning, and we needed a lot of education, which we were very, very fortunate to get. Marietta Strecker Cancer Center took us under their wing and really showed us and taught us everything we needed to know about survivorship care planning, including the incredible amount of manual work it was to create these forms. And so the goals that were set up as part of this grant was to either push the survivorship care plan to the patient's portal as an electronic document, to give the patient access to it electronically, and be able to share that document with other providers electronically through direct email, which is the HIPAA secure email system. And the other thing that we were trying to achieve was whether or not we could share this in a broader sense for other treating providers after the identified treating provider, maybe through use of the HIE. And then we were going to explore other methods. What we ran up against is technically is the formatting questions. This is an example, a sample of the ASCO, American Society of Clinical Oncologists Survivorship Care Plan. And as you can see, it is fairly detailed, requires a lot of manual information to be entered, even for those systems that have built their own survivorship care plan within their EHR. It's still, from what we heard from a number of sites, requires manual entry. But ASCO was the original group that was trying to make this process electronic in the hopes of sharing that on a wider basis, but also making it easier for cancer centers. So from that format, it went, what we saw is Journey Forward became the survivorship care plan that was used by a lot of groups, or they created their own template based upon Journey Forward. What people liked about Journey Forward is it was an electronic system, in the sense that you could enter information. It's web-based, you could enter information and then download the finished product. Everyone liked that, but in the year that a COC no longer made this mandatory to do cancer survivorship plans as part of an accreditation process, the Journey Forward template web portal was shut down. And so that no longer exists, but it was very common. And for those of you who are in cancer programs, you probably did make use of this. So by the end of year one, where were we? Other than Scott putting his head down, Scott's technical, and I think we both thought this was going to be a fairly straightforward process. But we saw so many issues at the end of year one. One being that the accreditation standards obviously had changed. We just talked about that. Although the breast cancer NAPBC is still in existence, and we'll look at that in just a second. The technical issues we were overwhelmed with because it did not fit into, as we talked about, that CCD format that is required in order to move stuff around electronically. Most EHR systems did not allow their users to use PDF format, which is what most of the cancer centers would do, is they would create these survivorship care plans and download them and create PDFs and then give that to the patient. But what we saw is if we wanted to move it electronically, most EHR systems did not allow that. It had to be in the CCD format. We saw, as part of the staffing issues, that there was lack of reimbursement to complete survivorship care plans, and there was a lack of clarity between the providers as to who was going to update the information around survivorship care plan. So as I mentioned, we did work with Marietta, we worked with Mosaic, which is a common EHR system, and it really came to a grinding halt after 6 or 8 months of work, because there was no integration between the cancer registry that Mosaic had sites use to enter their data and the underlying Mosaic EHR system. So we went back to ODH, and Emily was she was a shoulder to cry on, to say the least, for what we were trying to do. I think we're all like trying to figure it out. And one of the things, as the state of Ohio, you know that we take pride in how we stack up against other states. And so we said to Emily, do you have any idea what happened in the other states? Was anyone successful? Because, you know, a little dose of humility is good. And if somebody else had figured out how to do it, we wanted to see, and then see if we could bring it back to Ohio. And so with Emily's help, we were able to do a joint Zoom call with 7 or 8 of the Northeast states. and to talk to them about how they had done it at the end of this first year with their attempts to create electronic cancer survivorship forms. And I don't know if this made us feel good or bad, but there was not one state participating, and this was Maine, Massachusetts, New Hampshire, New Jersey, Rhode Island, Vermont, and Connecticut. None of them had been able to do it. Not one state had been able to do a fully electronic transmission of survivorship care plans. And so, as I said, it was kind of like the other shoe dropping at the end of that first year, and you felt both good and bad about it. And we all wondered where that was going to leave us with year two. So this year two is just closing now. And let me say, being Ohioans, we said, okay, we were not successful in year one. Can we do anything about it? And of course, we had to say, yes, of course we can. We can figure out something. And so we went back to the drawing board and we said, maybe our problem is what we're thinking about. What is a survivorship care plan? Because we, as I said, Scott and I walked into this project not knowing much, if anything, about survivorship care plans. We understood the technical side, but the actual planning side was another matter. But we did see, in looking back at those ASCO original templates and everything, that everything that we saw showed the survivorship care plan as one document with two purposes. One was to provide clinical information for subsequently treating providers about the clinical care that that patient received. The second purpose was to give the patient a document that helped them support them going forward in what they would need to do to be healthy and to have a true survivorship plan. And so the thought came up, okay, with COC changing their standards, is it possible for us to reconsider what is a survivorship care plan? You know, now that COC was not as linked into the original concept of survivorship care plan, what could we do to maybe be more creative? And so we said, rather than thinking of the survivorship care plan as one document, how about if we consider it as two documents? Could we somehow address the clinical needs of other treating providers at the same time that the other half, the patient-facing survivorship care plan, could be made more patient-friendly and be more helpful in the education and support it provided? So this is where we started. We looked at the new Commission on Cancer Accreditation standards, of which, as you can see, it went from the document being required, the document, every patient had to have a survivorship care plan created, to saying, oh, no, that survivorship care plan can be one of 10 different elements of a survivorship program, and of which you only had to have 3 elements that were worked into creating your survivorship program. So that was number one. We recognized that the National Accreditation Program for Breast Cancer Services, NAPBC, still required the survivorship care plan as its accreditation standard. But from what we've heard from Wendy and some of the other people, this apparently is being reconsidered right now, and they are trying to move their standards into closer alignment with the COC standards. So I'm going to guess, and this is just me talking, but I'm going to guess it sounds like they probably will remove it as a required part of their accreditation and instead do what COC has done, which was make it as part of a broader program of which the Cancer Center can work it in or not work it in, depending on how they set up their cancer planning. So here are the 10 areas that a cancer center can select from. As I said, they had to do 3 different services. So the survivorship care plan obviously is one. Screening, patient education, rehab services, nutrition services, psychological support, group support, service from experts, financial support, and physical activity. And I have to say, thinking back to our conversation with the other 8 states or so that we were talking to at the end of the first year, several of them commented on this change, that they felt it was really important to support the patients in some of these other ways, in nutrition and physical activity and psychological behavioral health needs and education, were some of the repeated topics that we've heard from other states.
Kathy, I wanted to chime in right there, if we can go back one slide for just a moment, just because we just had our survey. And so we had a surveyor, and although it talks in the standard that we need to document at least 3 services are offered, something that I think is very important for the audience to understand here is, let's take nutrition services or financial support services, for example. It's key to make sure that those nutrition services or financial services are offered after active treatment. So survivorship here doesn't mean supporting the patient with nutrition services during their active treatment phase. It is really about doing programming to support their nutrition needs after that active treatment phase. And so that's something that, some advice that we got. We obviously have nutrition services for our patients, and we were helping our patients, particularly during active care, but not necessarily lofting them and talking to them about nutritional advice and how to manage their lifestyle after active care. So that's important to note here when you're looking at the different services that you think you might want to offer as a entity in survivorship.
Oh, thanks, Wendy, for that input. And as you can see, where we're headed with this presentation is Wendy and her right-hand person, Rochelle, are going to be kind of laying out this process for you, because one of the, they brought it as kind of like an incredible bonus, is having just gone through COC accreditation review, they speak with voice of authority on these new standards. So hopefully you'll find that helpful. So Wendy, are you okay if I go ahead and look at the HIE slides and then turn it over to you?
Yes, absolutely. I just wanted to interject that there, since it was up on the screen, and it's so, you know, it's just it's a point of clarification that I think was pertinent.
Thanks so much. Okay, so what we did is, in reaching out to Wendy and Rochelle, we tried to be creative, as I said, going back to what we thought we could contribute as the HIE, which was a better picture of clinical data. And that in turn would free SOMC's Cancer Center to spend more time on this patient-centric care plan, as opposed to having to be concerned about creating this incredibly detailed clinical document to make available to other treating providers. So again, go back to what we talked about at the way beginning about information that flows through the HIE. One of the 155 hospitals in the state who send us information is SOMC's hospital itself. And they send us all kinds of information, labs, radiology, transcription, the information that's in the CCD, and the information that they send is then combined with information we receive from other sites for that patient, and you can review it either by encounter or by overall consolidated record. And so what this meant, what we were trying to look at, is if we had a patient that was referred to SOMC's Cancer Center, was this something, if they had been treated at SOMC, could their clinical information be found within the HIE and made available to other providers rather than having to, you know, recreate it as a separate document to send to those providers? And so in several test runs with SOMC. Wendy and Rochelle, I know, are going to talk about this when they get to their section, but we tried to establish what the pros and cons were of relying on the HIE for clinical information for subsequently treating providers. So the pros of it one of the pros is that all the information that is in the HIE is available to every treating provider in the state of Ohio. There is not a limitation on that. So if a site wants to get information on a patient or to see if it's available, they can come through the CliniSync HIE and get that information in what we call our community health record, or CHR, is where you access all this information. It includes information from all 155 hospitals around the state, so incredible amounts of information, and the data follows the patient. So the information is available from all types of sites, whether it's the hospital, whether it's an ambulatory site, an outpatient clinic. It comes together as part of the patient's consolidated record. The cons about using the HIE are several, and you need to be aware of that. The community health record is one of the things that we discovered early on in working with Wendy on this, is that the CHR is not understood by a lot of providers on how they can access and how they can use it. And so part of that is that there is so much clinical information available, it may be difficult to extract a small set of summary information, but there are ways that you can reconstruct the data that's presented to you to make it more easily understood. But this is not something that most providers come into recognizing that they can do when they start working with the HIE. And the third drawback is that if a hospital is not contributing data to CliniSync, the clinical information may not show up. And so in the Cincinnati area and for one system in Toledo are the areas where we may not have all the data. We may have some, but not all. And so that would be something to evaluate if you're planning to use the HIE to get your technical information. So going back to what the CCD format, this is merely the template so you can see how information presents within the HIE. And it runs through problems, procedures, vitals, goes down the list. And this is a summary of care that is created, as we said, by either an encounter or by combining all the information on the patient for whatever period of time you want to see it. So we went in and our goal was twofold. Are we going to be able to find the clinical data for patients who were treated in the SOMC hospital? So that's number one. And then the second goal was, can we also get information on patients that the SOMC Cancer Center is treating who received care at an outside hospital, in this case, Ohio State, we were looking at. So the first one is we look to see if the patient was an SOMC patient originally, were their records flowing, and could we, comprehend what was available. And so in this particular, this is information on patients actually in treatment. So on this particular patient, it does show up that on their problem or condition list that they do have a diagnosis of leukemia and malignant neoplasm. So then we're like, what else is available? And the care summary over here on the left-hand side shows the continuity of care visit document for a specific visit when the patient was last seen in the SOMC hospital. So we knew that particular document was there to give that encounter information. The other thing we were looking at is, could we find information from another hospital to see if those patients' data were accessible for SOMC's Cancer Center from this other treating hospital. And this one, I know it's a little hard to read, but this shows that this came from the OSU Wexner Medical Center. You can, in going to the HIE, you can access lab results by the specific test. In this case, this patient had a hepatic function panel. And for every single lab test, it shows the name of the ordering provider, the name of the performing lab, the date of the test, and the results. And as part of this, it goes through every single part of that lab test. As we know, they're frequently bundled in panels. And so each one is reported separately. And then if there is any abnormal, it is recognized within the system and is marked, as outside, as an outlier result. So that is the presentation of lab work within the HIE. The other thing that we found for this particular patient was whether or not there was an assessment and a treatment plan. And it obviously had a lot of information on the specific problem, but it also, if you went in, there is a treatment plan and gave a last assessment as to how that patient was doing when they were hospitalized. So the other thing, and this information was put together, this particular patient, because these were different patients that we were looking at, was developed by OSU in their treatment of the patient. And that information is all available in the HIE for all the medications that were attributed, prescribed for that patient, what the dosage is, again, whether it's an active or a historic document or prescription, and any specific notes on it. So this is all available within the Documents tab for the HIE. So we all felt comfortable that the clinical information was available within the HIE to support this move towards kind of going in two different directions for how survivorship care planning could be handled. And so that took us back round circle to SOMC's Cancer Center and what they were doing to make their system more patient-friendly in their survivorship programming planning program. So with that, I'm going to turn it over to Wendy and Michelle to talk about specifically what SOMC is doing. So Wendy, just give me a heads up when you want to advance the slides, okay?
Sure. So I want to set the stage by just saying, I really believe that the slide that Kathy reviewed, where she had the road coming together and then there were two arrows that go out in different directions. And if you think about it, we, for a long time as healthcare entities, have been gathering records and essentially been responsible for the knowing what's going on with the patient's either prior history and history into the future. And I think survivorship care plans, in a sense, got rooted into the technical details of trying to summarize the health care that I've had for providers and physicians. That has been something that we've been doing, if you're a cancer entity or you're a physician office, for a long, long time. And so it's kind of like this change in this whole survivorship into more like a treatment summary, into more like launching you into what do you need as a patient to move from treatment into survivorship. And I really think that that was the intent by the American College of Surgeons when they even started with the, and it sounded like a great idea to summarize the treatment, but in reality, cancer care is complex. And so that presented a lot of problems. So it's sort of like I can see the future now, next slide, of a day when we can get that information essentially through, like Kathy was explaining, the health information exchange, but we already had a solution for that, right? We always gathered the records, so we knew what was going on with the patient. So we're moving essentially our survivorship care plan and all the technical details into a short treatment summary and focusing more on what is their recommended follow-up schedules and what do they need to do to be a survivor, and what are those resources that we can help them with in that. And I believe that that's the road that COC and I believe NAPBC will take in the future to really focus on, and hopefully that will eliminate a lot of that record retrieving, manual, put on stuff processes through the care summaries like Kathy showed you in the HIE and CliniSync and some of those kinds of things. Next slide. There we go. So I'm just going to show you, we can move through this pretty quick, but essentially we're merging this by discrete fields that we have in Mosaic. So everything that you see with these sort of brackets around them automatically populate on our survivorship care plan template. And then we have automatically, instead of having to type this in here for every single patient, we've automatically added what is the key social work that's involved in the case, what is the palliative care specialist, what's the navigator, and everywhere you see these other brackets with that background information also comes. Remember, the discrete fields that go in the CCD also are capturable in your medical record. So we're using those discrete fields. If you've got them in the system, why not automatically populate it to your survivorship care plan? Next slide. So we're doing that to give the patient a brief summary of their cancer patient history and the treatments that they've had without all of the extra jargon and such, and really focusing, and I'll call your attention to more the lower third of this, in what are these recommendations for healthy lifestyle modifications. Next slide. What are your upcoming tests and follow-up appointments, which are also mergeable fields? And then the biggest thing that we've done is said, hey, we've tried for a little bit to get the surgeon and the medical oncologist and the radiation oncologist to say exactly what is the treatment plan going to be for this stage, for that stage. And what we realized is that no matter what we say, based on what the patient has and what's going on with their unique situation, we sometimes vary from that. But what is this supposed to be? This is supposed to be a tool that is a general guideline into what it is that you should do to follow up, because it's meant to say, hey, if you're not going to be seeing us at the SOMC Cancer Center and you're going to be having your next follow-up appointment in Florida, you need to know when that should be, right? And you need to make sure that you're having whatever those screening exams, those history and physicals, and whatever is needed to follow up with your cancer. So instead of trying to recreate the wheel, we've decided to use what NCCN does very well, and we've just snipped it and included it as a part of, so the patient can have, regardless as to what any provider says, can have some kind of recommendation as to what they need. Next slide. Again, making it a little bit more simple and easy to understand. And then again, I talked about what are the cancer center upcoming visits. This is an old snapshot of one that we provided, but what are the upcoming visits? Next slide. What are the resources that you might turn to that you know, might be included, and that could be a breast cancer foundation for young women, or it could be something for melanoma, or it could be smoking cessation materials. So we would then kind of customize that to whatever those current web or internet links are, because let's face it, that's where our patients are trying to find out this information, generally, most of the time. So, as I sort of already summarized, we did have a recent COC survey, and it really even gave us even more perspective on the rationale of from the survivorship care plan to transitioning the patient to survivorship. And really to transition that patient to survivorship, what do they need to know? They need to know, what do I need to follow up on the care for my cancer, how often that is, what are my future appointments, and how am I now going to live and thrive either with cancer or as a cancer survivor. So I see this future of using the health information exchange for healthcare providers to get this snapshot. And that doesn't, the survivorship care plan that we have today doesn't even need to go to their primary care physician or their involved providers. They're going to get all the relevant information. As Kathy discussed, it's changing all the time. Anything that we would give them is only a snapshot in time, and it's changed tomorrow. So the HIE is going to have that. We just need to all figure that out and see how we can communicate and find what it is that we need to do. And that feature is very close. And I believe that it's time to shift our content to what are the follow-up appointments, the follow-up recommendations, the screenings that you need to have, and more importantly, the mind-body coping tools critical to overcoming or living life with cancer, because we're moving cancer to a chronic disease in some cases. So what does that patient need to do to live life with cancer? What do they need to do from a nutritional perspective, from a physical perspective, in terms of exercise? And so I think that this shift will eliminate much of that time burden that we've all been doing out there in putting that survivorship care plan together and focusing on some kind of consolidated record that already exists. And then shifting that to focus on those mind-body aspects for the patient. Next slide. So regardless, because we are in a PBC and COC, we are continuing to provide these treatment care summaries and survivorship discussions for patients. And we're doing that across all sites. And then our second and third focuses of the three focuses of the scope of 10 that Kathy was reviewing are really focusing on support group referral. And now, really, that's opened up a whole new world of resources for patients in terms of Zoom and the different. We struggled being small, having a breast cancer support group and a lung cancer support group and an ovarian cancer support group. And now it's about referring patients to online and other resources or connecting them with others. And they may not be others that are within our cancer center, but others that are within these online targeted resources. And then we're focusing on exercise programming. We're going to have some yoga classes that are available actually right here within the cancer center that don't necessarily, because I think there can be some body issues, especially right after treatment, that they may not feel comfortable with heading to the gym and integrating with classes that are with the main population. So those are kind of the three things that we're doing. But I think the biggest thing that I want to do is stop focusing on all the clinical aspects of what that treatment summary is, and relying on the HIE to do that for us so that we can shift on how do I live now with cancer or without it into that survivorship, and focusing our resources there. Next slide. But that's just a pretty picture just to transition back to Kathy and talking about some of the yoga and Reiki that we're going to do for our patients.
Okay, so as our last point, moving ahead in this next year for the grant, is we are planning to concentrate on educational information for oncologists and providers in the cancer control area to show them the community health record and what information is available. Then demonstrate how that can be customized within the CHR to make it more usable for patients that have these, long summaries where you know what you need in order to transmit that information to other people, and we can show them how those people can review the record for specific points that they are looking for rather than having to sort through everything. And then we will be doing some educational sessions about this for staff and clinical specialists around the cancer programs, so survivorship programs. So with that, I have to thank Wendy and Rochelle, but we are opening now for questions, and I'm going to turn it over to Scott so he can tell us exactly what's come in.
All right, we do have a couple questions. First question is just about the recording. When will the recording be available? Give me until the end of the week. I will upload the recording to the CliniSync YouTube channel. Okay, first question. There is a saying, survivorship begins at the time of diagnosis. Has there been any discussions in presenting survivorship visits pre-treatment and providing those resources up front? Almost like a needs assessment and education session. I wonder if this would also engage patients to follow up closer with survivorship after treatment.
Oh, excellent question. Wendy and Rochelle, what do you think about that?
Yeah, I got that one if Rochelle doesn't mind. So we've actually done that too, and it's something that I don't think that I talked about, but we are actually, during our new chemo education, we are actually introducing the patient to our survivorship owner, I would say. So the person that is delivering the survivorship visits, and he is actually saying, I'm going to be that coach and I'm going to be that person. I know you're in your active cancer care, but here's the deal. Here's everything about your chemo medications and the things that you're going to have now. I'm going to be here for you beside your oncologist to manage any acute visits, things, nausea, vomiting, things that you didn't expect from your chemotherapy. And I'm giving you an appointment right now today to meet with me in 6 months so that we can talk about how things went and where we're going to go for the future. So we give that appointment at his first juncture. He introduces himself, and if nothing else, if you don't need him in the acute care phase, he says, you're going to see me again because we're going to discuss what you had and where we're going to go next. So he's kind of like, I'm step 1 and step 2.
Okay, next question is around appointments. Have you had any resistance from patients related to one more appointment and general misunderstandings as to what the intent of the appointment is, and how have you timed the scheduling of the appointment?
Rochelle, you want that one?
Okay, yeah. That has been a major hurdle for us as well, especially during COVID. You know, it just kind of tripled in the effect we had with it. But like Wendy said, when they know that that's coming down the pike at the end of their treatment, and the nurses and the nurse prac and the providers are talking to them about it, then there's more engagement in it, knowing that that's going to come at a later date. You know, we've tried all kinds of processes with this, and this seems the best one that we have found to be working to have participation in it.
Okay, that's all of our questions.
Okay, if there aren't any more, any in the chat?
No, ma'am.
Okay, Wendy and Rochelle, we can't thank you enough for your work on this, and your patients are very lucky to have you working with them at SOMC. And we thank you all for joining us. Enjoy this beautiful day, and hopefully we'll get together again sometime in the next year to follow this through and see where the rest of you are with survivorship planning. Thanks again.
Thank you. Thanks for the opportunity.
Bye.